everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. I just recently had a baby myself. My little one is going to be 8 weeks old very soon. In this sleep series, we're going to be talking about a ton of things. As a pediatrician with a pretty big social media following, I get so many questions from parents. Questions about when it's safe to start sleep training, what is sleep training, when can your child sleep through the night, what is sleeping through the night, is there a perfect age, is there a perfect weight, is it okay to let them cry? The list goes on and on. So we're going to tease apart some of these questions in a lot of these videos going forth. Today's video, we're going to talk mostly about causes why your baby won't sleep. There's so many reasons why a child won't sleep. So as a pediatrician and as a parent, I'm going to go through some of the most common reasons that you should be thinking about before you even start thinking of sleep training your child. As a pediatrician, the first thing I gotta say is you first have to rule out medical causes. What does that even mean? Well, there's a lot of reasons why a baby may not sleep or may not be able to sleep for longer windows of time. Some of those would be something like reflux, so your baby is potentially spitting up or vomiting very frequently. The other one might be things like an allergy, a dairy allergy potentially, that could be causing them to be fussy and stay awake for longer periods of time. There are so many different reasons medically that your child might be staying up for longer windows of time and may not be sleeping. So first and foremost, you have to rule out a medical cause. I can't do that for you in this video. That's something I can provide for my parents in my clinic and in the exam room, but that's something you have to talk to your personal pediatrician about to make sure that you rule out any medical causes why your child won't be sleeping. Of course, there's other things as well. Things like even eczema that's uncontrolled that could be making them very uncomfortable. A lot of unseen things. So make sure that you are checking in with your child's pediatrician. Moving on. Once a medical cause has been ruled out, I have to say there could be reasons why a child would be more awake, and some of those being that a child is just naturally a more awake being. There's a lot of sleep guidance out there, and most newborns sleep, and I'm talking about newborns in the first 4 weeks of life, about 15 to 17 hours a day. Some of those would be split up over a couple of naps, and especially in the beginning newborn period of time, you have to be waking up that baby a little bit more consistently so that they're getting all those feeds in and gaining appropriate calories and regaining their birth weight. So some babies may not be hitting that 15 to 17 hour mark, and that's okay. There's a lot of apps out there that allow you to track your baby's sleep, so you can actually see how long their naps are. You can see what length of sleep they're getting, and if you're not hitting that 15 to 17 hour mark, no need to panic. That is totally okay. So just know that some babies are naturally more awake. If your baby is naturally more awake and content and happy, that's okay. You can roll with it. Sure, I like to give at least 1 hour naps, but if that's not happening, make sure, again, you go back to number one, rule out any medical cause. Try to, again, comfort your baby through that hopefully 1 hour period. But if they're not giving you longer stretches, it's okay. Some babies are naturally more awake, not having huge long naps, and they are content. In which case, it's just unique to your baby. You might have other children who are better nappers, which brings me to my next point. Make sure you're recognizing awake windows and sleep windows for babies. These are super subtle in the beginning. As you become more confident in your parenting, you'll learn what your child's sleepiness signs are. For example, my oldest daughter had very different sleepiness signs than my second daughter did. Same thing about even the way I put them to sleep, which we'll talk more about in a future video about how I sleep train my girls. But make sure you recognize sleep windows and wake windows for your kids. I think that there's a lot of great guidance out there. And just make sure you kind of recognize it just like you would with potty training. When you're potty training your little one, there's subtle cues to know that your child's ready to go to the bathroom. Same thing. Subtle cues that your child will give you that they are ready to go to bed. Why is it so important? Because you don't want your child to become overtired. When they're overtired, they get overstimulated. Lots of crying, lots of fussing, really difficult trying to put themselves to sleep, and they may even begin to fight their sleep. So it's very important to recognize those awake windows and sleep windows. This is really important because I think it goes part and parcel with my next part. keeping a routine. When you're worried about your baby not sleeping, first thing you gotta ask yourself is, do I have a routine set up for my baby? If the answer is no, then that might be part of the problem. The reason this is so important is a child becomes very familiar with routines. It starts to set the background for, yep, this is the time that I'm gonna eat. Yep, this is the time that my caregiver is probably gonna come grab me. Yes, this is the time that it's time to go to sleep. It's very helpful for the baby's development and super helpful as a parent. I can say practically a routine gave me some idea of how long my baby was supposed to sleep. Most routines do involve some degree of a bath, bottle or breastfeeding, and a book, especially in the evening. I find that a bath can really relax your baby. The book is very helpful because it breaks up the association between a feed and sleep, which as your child gets older can be super helpful. And right now, you can actually click on the link in the show notes and buy my book, It's Time to Say Goodnight, a children's bedtime book, and DM me the receipt on Instagram and be entered to win a free sleep consultation with me. If you're watching this video at a later date, please know that this consultation is good through December 2021. If you're watching after, please feel free to pick up the book at the link below, but just know that this free sleep consultation is for a limited time offer. Now, when we're talking about the best routine for your child, that's something that we're going to elaborate on more in the next video. So make sure you tune into that, hit subscribe below so you don't miss it.